26% of Americans suffer from a diagnosable mental illness each year. And given that staggering rate, that means that this is an incredibly important topic to discuss, not only in terms of being in a general psychology class, but also because people family members, friends, or even yourself might be going through these issues. And before we get started, I actually want to just make sure that as a student, you have free access to counseling through the Student Health Center at Pierce College. And so make sure you go to the website at Pierce College, or I included some of the contact information in this module if you feel like you or somebody you know is having concerns in terms of psychological disorder. Okay, so let's get into it. The first question we really have to consider is, what is a disorder? Because there's a lot of complexities involved here. When you go from the term normal to abnormal, it's as though there's this like line in the sand. And if you're on this side, you're good. If you're on this side, you're bad. Well, that's clearly not the case. It's also not the case that this is a black and white issue. It's much more gray. It's much more complex. And I think another important consideration is that what causes psychological disorder is an interaction of biopsychosocial forces. So as we'll see in the therapy module, which is to come next, to treat psychological disorder, we often need a biopsychosocial approach. All right, but nevertheless, we typically require a few different criteria for something to be considered a disorder. And so the first is abnormality. And I actually want to use an example of obsessive compulsive disorder, or OCD, to go through these criteria. But these criteria have to apply for any disorder. And as you're going to see, we cover a number of different disorders, various categories, which we'll talk about soon. So the first is abnormality. Somebody with OCD, they might be obsessed with germs, and that gives them lots of anxiety. And so in order to reduce that anxiety, they might engage in compulsive behaviors like washing their hands. So first and foremost, everybody should be concerned about germs because they're potentially harmful. They can make you sick. And everybody should wash their hands. That's one of the best ways to prevent, the spread of illness. But when it comes to a disorder, we're talking about an abnormal range. So people with OCD, for example, they might think about germs for, hours upon hours every day. And they might wash their hands hundreds of times. So clearly there's a difference between what we might consider a typical or a normal amount of certain thoughts and behaviors and then abnormal. But where is that line? Where do you go from normal to abnormal? Again, this is not a perfect science. It's not black and white. This is somewhat of a subjective, interpretable concept, the nature of psychological disorders. And sometimes it's culturally specific. So in one culture, certain behaviors might be considered completely normal, and in another culture, there's might be symptoms of psychological disorder. So it really gets at this idea of the complexities of diagnosing psychological disorder. The second criteria for a disorder is it has to be dysfunctional. The individual's thoughts or behaviors, they're not adaptive. They might even be harmful. So again, washing your hands, that's completely functional. But somebody with OCD, they might wash their hands so many times that it actually, starts to harm the skin on their hands. The skin might become chafed and bleeding. Or maybe they're washing their hands so many times that, the wounds on their hands don't heal. And so they're actually more susceptible to germs and things like that. This is just one example, but the idea is that all psychological disorders fall under this category of the individual's thoughts and behaviors are not helpful, they're actually harmful. Third, The thoughts or behaviors associated here must be deemed troublesome, either by society or the individual. So, a lot of the disorders we talk about, like major depressive disorder or OCD, they cause harm to the individual. They prevent the individual from holding down a job or maintaining healthy relationships. But sometimes it's society that actually deems these things troublesome. So, for example, antisocial personality disorder, more commonly known as psychopathy. Somebody who's a psychopath, they don't feel like their crime and their antisocial behavior is wrong. They have no moral compass. But clearly, society is going to say, hey, that's a problem. So troublesome. And then finally, unjustifiable or irrational. The individual's behavior can't be explained as having some, justifiable reason behind it. So, for example, we talked about washing your hands. That's justifiable, but it goes to a point where it becomes irrational. You shouldn't have to miss your job or be late for work every single day because you were so busy washing your hands. At some point, the individual's behavior goes from justifiable to unjustifiable. And that, again, it's the fourth criteria here, another criteria for being disordered. All right, so although this is not a perfect science, psychologists and psychiatrists are trying their best to make this a reliable and valid process so that we can better understand and more accurately diagnose mental disorder. And what you're seeing here is the front cover of the DSM-5. The DSM is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This is published by the American Psychiatric Association, and it is basically a manual that is full of every currently recognized mental disorder and the symptoms involved. This is a living document. Right off the bat, you see it's the 5th edition. That means that it is continuously edited and revised for a number of reasons. So, for example, we often learn more through research about what is and what is not a disorder. And I think one of the most obvious examples is that homosexuality was originally listed in the DSM as a mental disorder. And clearly we know that it's not a mental disorder today, so it was removed. But the idea here is that this is a living document. Psychologists and psychiatrists, they go to these conferences, they debate. So again, this gets at the idea of, psychological disorders is a really complex topic. Nevertheless, we use this manual to diagnose. And what that really does, though, when you diagnose somebody with a disorder is you label them. You say, well, you are an individual with OCD, or you are an individual with depression. There's advantages and disadvantages to this sort of classifying and labeling process we have here. Now, I think I would argue that the advantages or the pros, they outweigh the disadvantages or the cons. But nevertheless, there are disadvantages. Let's start with those. The biggest disadvantage to this process is stigma. Stigmatization basically means that we might discriminate or treat people negatively or unfairly simply because of the label or the diagnosis that they've been given. So, for example, imagine if you found out that one of your professors or your boss was diagnosed with schizophrenia. Do you think that might maybe make you think differently about that person and maybe even discriminate against them? So a lot of the problem with stigmatization comes from misunderstanding. A lot of us are not experts on all of the different mental disorders. In fact, there are a lot of mental disorders that are currently recognized. So even as a psychologist, I myself am not an expert on all of the different disorders. And that misunderstanding doesn't allow me to treat people 100% fairly because I don't have all the information that I need. So that's a huge problem. Stigma, we treat others negatively. There's also self-stigma. You might view yourself negatively if you've been given the diagnosis, like, oh, I have OCD, therefore I'm not as good. So that's a problem. But the advantages are vast. And I think the biggest advantage is that by organizing our understanding of mental disorder, it allows us to treat disorders more effectively. So, for example, we can communicate about this disorder versus another disorder by organizing this information into categories and and conducting research within specific diagnoses that allow us to ultimately break down stigma. So the biggest advantage to this process is it allows us to understand disorders because, as we started this video, 26% of Americans in a given year are suffering from a mental disorder. So this is a really big problem. And it's one that I think our society is starting to address more and more. For example, the MCAT, which is the test that you might take to become a doctor, to get into medical school, they just added a psychology section. And I think that's important because what it tells me is that sort of at a society level, we're starting to take mental health more seriously. Where, there's stigma. If you break your arm, you have probably no problems going to see a medical doctor to get that arm fixed. But for some reason, when there's something psychologically wrong, which is really common, there's a sort of a hesitancy, I think, for a lot of people to seek out mental health counselors and therapists and psychologists and psychiatrists, even though, as we'll see in the next module, therapy is effective. There are effective ways to deal with the mental disorders that we cover in this module. All right, so that's it for now. Move forward to learn more about different categories of disorder, all the really, from a scientific standpoint, all the really fascinating symptoms that go along with disorder. And don't diagnose yourself. Again, if you feel like you have any concerns, please see a professional. And as a student, you have free access to counseling here at Pierce College. If you're not a student and you're just watching this video, please look online. There are amazing resources for everybody out there. All right, so I hope you enjoyed this video.